name is Ofnamia Rita, a student midwife doing bachelor's in midwifery top-up, and my case presentation is for Miss Chomhanj Medias, a 70-year-old woman. She stays in Chitabwenda. She's a widow. She's a Protestant by religion. She's a peasant by occupation. Her social history: she doesn't smoke, and she also doesn't take alcohol. She stays with her 2 daughters. She's not educated, and her source of income is through agriculture. Her past medical history: she's a known hypertensive patient on drugs for a full year now. She's non-diabetic. She's HIV negative, and she reports no history of having screened for cervical cancer for cervical cancer. Her obstetric and gynecological history: she's a para 8+2, and all these children were delivered by spontaneous vertex delivery. She's in her menopause. She has no any known allergies to drugs or foods. Right now she's alert, conscious, and oriented. Her vital observations are normal. Temperature is 36.7. Respiration is 18 beats per minute. Pulse rate 86 beats per minute. And the blood pressure is 135 out of 100 millimeters of mercury. So her general condition is fair. She's not in distress. Her presenting complaints: she presented with foul-smelling vaginal discharge, which she said that this has spent a full year. She also presented with abnormal vaginal bleeding, which has also spent a full year. She also presented with lower abdominal pain and pelvic pain, which is on and off, and this has also been there for a full year. She told me she was taking some painkillers and the pain could go off. So the history of the presenting illness: she was apparently well until when she developed that foul-smelling discharge and low abdominal pain, plus the pelvic pain that worsened progressively. This is what forced her to seek for medical attention. And when she reached there, she was diagnosed with cervical cancer after picking a biopsy, which this biopsy confirmed cancer of the cervix. Clinical staging was done, and this reviewed stage 3B, cancer of the cervix, stage 3B. The pathogenesis of the disease: cervical cancer, this is the cancer of the cervix. It originates from the cervix, though it can spread to other parts of the body, to other structures of the body, like the lungs, the liver, the pelvic walls, if not managed early. How does it manifest? How does it come about? It develops when a woman has long-term infection with high-risk HPV DNA, especially 16 and 18. These viruses cause changes in the cells of the cervix, making them grow abnormally and uncontrollable. So, over time, these abnormal cells become cancerous and invade deeper tissues of the cervix. So as the cancer progresses, it spreads directly to nearby structures such as the vagina through local tissue invasion. It can also spread through the lymphatic system, and it can also spread through the blood streams to distant structures like the lungs and the liver. How does it manifest? What are the clinical manifestations of cervical cancer? A patient with cervical cancer will present with foul-smelling vaginal discharge. She will also come to you complaining of abnormal PV bleeding. She will complain to you that she has painful micturition. Yes, it can also happen. Painful intercourse, which is accompanied with PV bleeding. She can also present with pelvic pain, and this worsens as the cancer tumor grows. This is because the tumor invades the surrounding tissues and nerves, worsening the pain. So this patient will manifest with abnormal vaginal discharge, and this is because the tumor may become infected or break down, producing this discharge. She will also present with abnormal vaginal bleeding. This occurs because the cancer growth damages the blood vessels, causing this bleeding. The patient will also present with lower back pain. The pain may persist in the lower back or hip, and this is because as the cancer advances, it may spread to the tissues around the pelvis and affect the nearby tissues. The patient will also present with urinary symptoms like blood in urine, and this is due to urinary retention, because as the disease advances, it may involve the bladder. We also have the bowel symptoms like constipation. As this tumor grows, it compresses the rectum, it compresses the rectum, and the nerves will be compressed, hence causing constipation. There will also be swelling of the legs. This may be one or both legs, and this may be because the tumor blocks the lymphatic drainage, compressing the blood vessels, hence causing the swelling of the legs. What investigations are done on a cervical cancer patient? First of all, we shall do CBC. This will be done to detect anemia, to rule out any infection, and to also provide a baseline for treatment, because chemotherapy and radiotherapy can affect the bone marrows. We also do the liver function tests. Here we want to rule out the liver mets. We want to see if the liver is also involved. We want to see how well is the liver. We shall also do the liver function tests. The renal function tests. We want to see if the kidneys are working properly before any treatment is given. So we want to see if the kidneys are also involved. We also do the chest X-ray. This is done to rule out the lung mets. Yes. Then we shall also do the pelvic scan. This is done to evaluate the spread of the nearby pelvic organs. What is my nursing diagnosis? What is my nursing diagnosis? My nursing diagnosis here would be acute pain related to tumor invasion of the pelvic tissue surrounding the nerves, and this will be evidenced by the patient verbalizing pain. There will be risk of infections, and this is related to the necrotic tumor tissue evidenced by foul-smelling discharge. So what is the treatment given to this patient? First of all, we shall have to counsel this patient to allay anxiety and also reduce on the stress. So we shall also have to prevent infections by giving antibiotics to this patient. We shall have to prevent anemia by giving iron supplements and doing blood transfusion where necessary in case the HPV is low. So, according to the stage, the patient will be referred. So, for a patient who has stage 1, a TAH will be done and the sample will be taken for histology. Then, for stages 2, 3B and 4A, the patient will be referred to Uganda Cancer Institute for chemoradiotherapy. Then for stage 4B and above, the patient will be referred to Uganda Cancer Institute for palliative chemotherapy. What are the complications for cervical cancer? There will be psychological distress because the diagnosis of advanced cancer often causes anxiety, depression, and fear. There will also be infection and sepsis, which is due to the necrotic cancer tissue that provide a medium for bacterial growth. There will be severe anemia because continuous vaginal bleeding causes chronic loss of red blood cells, leading to anemia. Then there will be metastasis. Cervical cancer spreads to nearby tissues and to distant organs such as the lungs. So if not treated early, there are going to be metastasis to the nearby organs and to the distant organs like the liver and the lungs. There will also be kidney failure if this patient is not managed early. As the tumor grows, it squeezes the ureters and this causes kidney issues. So, and eventually, if this patient is not managed early, there will be death. Thank you so much.